We can now say that the summer is well and truly over, with the colder weather creeping in and the inevitable shorter days. Sadly, we have to say goodbye to our friend the sun. So how does that affect our vitamin D levels? It is well known we do not make enough vitamin D during the winter months, and this is because of a smaller zenith angle of the sun and insufficient UVB light intensity. Even if the sun is shining brightly, and regardless of duration of exposure from October until the end of March, our ability to produce vitamin D is greatly reduced for those 6 months of the year. Research shows living at higher latitudes and having less sun exposure increases the risk for many chronic illnesses and infectious diseases. However, sun exposure is important as it is our major source of vitamin D. Over the last few decades, we have been warned by dermatologists and the sunscreen industry that any sun exposure may increase the risk of skin cancer. However, recent research shows that sensible and moderate sun exposure, so for about 15 to 30 minutes in the midday summer sun, leads to a pinkening of the skin and is beneficial to health. As vitamin D is involved in many biological processes, such as helping to regulate blood pressure, as well as helping to make endorphins for improved mood and increasing nitric oxide production. Furthermore, in contrast to contrary belief, sensible skin exposure has actually been found to decrease the risk of malignant melanoma. Wearing sunscreens of 30 may reduce the capacity of the skin to produce vitamin D by almost 98%, as well as preventing all the other important phytoproducts such as increased nitric oxide, serotonin and endorphin production. So why exactly is vitamin D so important? Well, it plays a key role in numerous physiological processes. Some I've already mentioned. Virtually every cell in the body has a vitamin D receptor. It influences the expression of more than 200 genes by communicating directly with our DNA. Studies have found that vitamin D offers antioxidant benefits as well as supporting cardiovascular health and improving levels of insulin. It's important for increasing the absorption of calcium and in bone health, as well as improving muscular function. It's an immunity booster found to protect the lungs, whilst reducing the risk of autoimmune diseases and inflammation, and may offer protection against cancer, as well as supporting brain health by preventing the loss of neurons in the brain. So as you can see, having optimal levels of vitamin D has many benefits. However, it has been estimated that on average almost 1 billion people worldwide may have deficient or insufficient levels of vitamin D, according to recent research. Our vitamin D levels are affected by many factors, such as I've already mentioned the sunscreen usage, our clothing, the latitude of where we live, as well as dietary and lifestyle factors. Furthermore, those that are over 65 years of age have a lower capacity to produce vitamin D in their skin, whilst obese individuals tend to have lower vitamin D levels overall. Some medications have also been found to affect vitamin D metabolism. Our modern life and longer working hours have led to us spending fewer hours outside, reducing our sun exposure. Additionally, some individuals may even have a genetically determined difficulty in absorption of vitamin D. So how do you ascertain your vitamin D levels? Testing and maintaining levels of vitamin D is important to prevent deficiency as well as preventing toxicity. Your GP or functional practitioner can carry out a 25-hydroxy vitamin D blood test to measure the active vitamin in your bloodstream. There is currently only one reference range used for patients. However, it is important to note that optimal vitamin D levels may vary from population to population. Therefore, it's important to make sure that measured vitamin D levels are within functional limits for health, not just within normal limits that are just defined to avoid severe vitamin D deficiency, such as seen in rickets. The Institute for Functional Medicine advises that blood levels of vitamin D should range from between 50 to 80 for optimal health benefits. If you require supplementation because your levels are low, then it's also important to recheck your levels after 3 months to see if you have achieved an adequate level of vitamin D. If your numbers have improved, then it's also important to lower the dose accordingly. If levels have not improved, then it may be worthwhile to consider testing for genetic polymorphisms that may slow or inhibit your body's ability to convert vitamin D. Both vitamin D and vitamin D3 are available in supplement form, and many patients are prescribed vitamin D2, a synthetic version. However, this is not the most bioavailable form. Taking the D3 has been shown to be much more effective in raising blood levels of vitamin D. This is because the body will always need to convert any stored form of vitamin D3 into the active form. Both D2 and D3 can also be attained from food sources. D3 can be found in animal sources such as fish oil, liver, egg yolk and butter, dietary supplements and of course the sun, whereas D2 mainly comes from plant sources, fortified foods, mushrooms grown in UV light as well as dietary supplements. However, it is impossible to get enough vitamin D from dietary sources. So what to do during the winter? Consider supplementing if your levels are low based on your current vitamin D blood level. However, be aware that mega doses of isolated nutrients can be harmful, so it's important to get the right dose as toxicity may occur. Vitamin D is also a fat-soluble vitamin, which means that it requires dietary fat to be absorbed by the body. Dietary fat stimulates the release of bile from the small intestines, which helps the digestion of fat and fat-soluble vitamins. So taking your vitamin D supplement with your meal may boost absorption substantially. In order to increase your vitamin D levels, it's best to include other fat-soluble vitamins, so A, D and K, as these work together synergistically. Vitamin D3 and K2 work together to strengthen bones. When taking D, it's also important to get adequate amounts of magnesium to ensure that you can absorb calcium effectively. Other options are to use an indoor ultraviolet B UV lamp, which triggers vitamin D production in the skin to help correct vitamin D deficiency. So in conclusion, since vitamin D is a hormone, its levels fluctuate differently for everyone. Seasonal changes affect it too. So during the winter, when there is a lack of sunshine, it is important to get your levels measured. And if you have a deficiency, to correct it. I hope that this information about vitamin D has been helpful. Thank you very much.